Hello and welcome to the Ask Nurse Linda webinar. I always say it's so nice to be here, but it is really nice to be here. And I was just talking to my colleagues that you cannot see that are busily working behind the scenes. And so I thank them all for that, all the support that I get. But we were just talking, and sometimes I just lose track of what's going on. And anyway, we have a good time. So it's always nice to be with everybody today. And today I'm going to remember to describe myself because I always forget to do that, even though I have it written on a piece of paper that's right down here on my desk, which you cannot see, but I forget to look over there sometimes. But anyway, I am a woman. I have brown hair with silver streaks in it. I used to pay a lot of money to have my hair highlighted. I no longer have that expense, so good for me. I wear clear frame glasses, and today I have a blue shirt on with tiny little navy polka dots on it. So and my background is just a plain white wall, which I find to be just enough. It doesn't distract from anything. So I've been thinking a lot about things, and there's so much bad weather going on, and I just want everybody to be cautious, to be sure and remember to have a plan in place no matter where you are, because you never know what's going to be happening. And so always have a plan in place for what you're going to do should something happen. And I am reminded when I see these tragedies on TV and people will come out and they've met at their place where their designated spot that they've set up to meet their family members and, to get in contact with everybody because sometimes there's no phone service or whatever. So people have that plan for what am I going to do in the middle of this tornado or whatever's going on. We had one that came right over my house, not too, just like a few weeks ago. Fortunately, I didn't have any trouble at my house, but a lot of people around me did. And so it always reminds me that people have their plan. They're very good about how they're going to take care of themselves, how they're going to meet up with their family. But sometimes people forget about, okay, now we've had the disaster. My house is destroyed. I can't live in it. What am I going to do now? Where am I going to go? So have a long-term plan as well as a short-term plan. So once you get together with your family and, everybody's, okay, we're all safe now. What are we going to do? Especially if you are an individual that needs specialized equipment. Where will you go if you cannot sleep in your hospital bed, or if you don't have your pressure dispersing mattress, or you don't have a place to plug in your power chair? There's all kinds of things. If you don't have a place to plug in your ventilator, the battery only lasts for so long. So there are shelters that you can go to but they might not have the equipment that you need. So be sure and talk to your people in your community. If you haven't registered yourself with the EMTs, so that they know that this house has a person who will need special help to get out of the house, or if the power goes off, they'll need their extra power turned on quickly for their ventilator. Be sure and tell your utilities company because they will try to get your house set up quicker, knowing that there's a person who's really depending on this. But where can you go? You can go to a shelter and they'll have power there. They'll have electricity there, but they probably will have cots and not a hospital bed or the kind of equipment that you need. So find out from your EMTs, if something would happen, where would you go? Now, sometimes long-term care facilities will have a room with a bed that you can use, so they'll have more equipment that's available. This is not saying that you become a patient there, that just if the EMTs know about you, they will be able to set up appropriate facility where you can go. You might still need your family to come in and take care of you. They're not providing care. You're not a patient, but it has the supplies that you need. They might take you to the local hospital that, again, you might be admitted as a patient due to the weather situation, or it might just be a boarding type of issue. And your community generally, not always, will pay if services are needed. But if you're just like lodging there and somebody else is doing your care, you're not going to be able to call the nurse and have her come in. So just know what's going on in those kinds of situations. So it's always different. Now, I received an email the other day, which made me quite excited. It was just yesterday. So I don't know much about this organization, but I want to highlight it to everyone. And I'm really sending my positive vibes to them because I want them to be so successful. It's kind of a newer organization, but it's called terryslegacy.org. And wait till you hear this. They are helping people who have spinal cord injury renovate their homes. So if you might need something like a ramp put in, or if you need a wider door to your bathroom, I don't know a lot of details about it because, as I said, I just learned about it yesterday. But I wish them every success. They're only serving the area in Berks County in Pennsylvania. So I'm not at all familiar with that. But if you go to Terry's, Terry, legacy, oh no, Terrys, legacy, all one word, .org, you can get more information about them. And so I was looking at their website, and there's not a lot of information on there about exactly what they do. They do take donations if anybody is interested in helping them fund. They have fundraisers, and then they're helping people in that area. It makes me think of what started out as Tunnel to Towers and how that has grown. And I wish they would include people with neurological disease in their program, but they don't. Well, unless you are a firefighter or police officer, policeman or something, so or in the military, they support that. But let's wish Terry's Legacy very much success, and that they'll even be able to expand. But if you happen to live in Berks County, hey, give them a call because that's going to be right up your alley for things that you need. So let's talk about some of these questions that we have today. And I'm just going to look around. That you'll see in the chat box, there's a link to the toolkit for emergency preparation, and that is really detailed. It's a small booklet, but you can just download it right off the internet, as you can with all the information from the Reeve Foundation. There's no charge to you, so that's a good thing to go because it really outlines A to Z, a lot of things that you might think, oh, I knew this. Oh, wait, I didn't think about that. So it's always good to have those little reviews every now and again to kind of set your plan forward and in motion. So we have first question is about electrical stimulation. Can electrical stimulation help with building muscle after spinal cord injury? Or I'm going to expand it to any type of paralysis. And why, yes, it can, because what it does is the electrical stimulation stimulates the nerves, nerves stimulate muscles. So if you're doing the functional electrical stimulation bike riding, you'll notice that your muscles are getting bigger because that stimulation, the electrical stimulations go directly on a muscle over which is innervated by a nerve. And so those muscles get real big and juicy, as we like to say in the healthcare world. So you get a big juicy muscle there. When you're sitting on a big juicy muscle, you have less risk of skin breakdown. It's when you're sitting on muscle that's kind of thinned out because it's not getting that electrical stimulation from the brain. So sometimes the muscles thin out. Sometimes if you have an extra, people say, oh, I don't need any pressure dispersing equipment because I've got enough fat on me. And we all have enough fat on us, but fat collapses, so it adds more pressure. But also, if you don't have a lot of fat, then you have less cushion, as they say. And so being extremely underweight or being extremely overweight, both of those are bad for pressure injuries. So yes, if you're doing the FES biking, you are building up your muscles. Now, if you have the strip down your back and you're using that, these new companies are coming out with they put a strip along right down the spinal cord, and SpaceX Onward. We've had both of them on the professional shows. So if you go to the YouTube website, you can hear more about those. Those companies are planning to go to market, and so they will be you will be able to get their product wherever you are. It's a tape that goes down along the spinal cord, not the entirety of the spinal cord, only a certain, either you do it up higher if you have tetraplegia, or you do it a little lower if you have paraplegia. And it does all kinds of functions because that electricity is being run right into the spinal cord, and then your movement comes from that. And so as you have that movement and you keep doing activities, you build up your muscles. It's the same kind of thing. It's just two different methods of distributing that. So yes, it certainly can help with muscle building, and it's being quite successful in the clinical trials with increasing function. Now, not everybody wants this. I realize that. Many people are content with the way that they are, and that's perfectly fine. Some people want this equipment right now, this afternoon. They'll be looking up the different companies that have all this kind of product. There's several companies that are coming out with these kind of products, and people will be like, I'm all in, give it to me this afternoon. Well, it's not quite ready this afternoon, but it'll be coming very soon. So whatever you are, just know about it so you can decide. Some people, they're like, well, it's too new. I want to wait a while and see. And that's fine too. You have to do what's right for you. So this electrical stimulation is fruits of labor for years and years and years of getting it to this point. And it's going to continue to get better, and it's going to continue to improve. It's going to be a piece of the puzzle. It's not the end all be all answer, but it's going to be a piece of the puzzle. There was another person that wrote in. Oh, actually, I got a question from him directly asking if their electrical stimulation worked with Brown-Séquard syndrome, which is a part of the spinal cord that's damaged, and it usually affects the upper extremities. And so, because it only affects, if the spinal cord is, this is the spinal cord, it only affects a piece of the puzzle there, doesn't affect the whole entire spinal cord, so it doesn't block all the messages, but it affects usually more of the upper extremities. And he wrote in, would that help me? Yes. Would it help people who have Parkinson's disease, or would it help people with other kinds of neurological diseases? Probably. These devices won't be marketed in that way immediately. If you have a stroke, there's already electrical stimulation devices. There's a contraption that you put on, it's like a sleeve on your arm. So if you've had a stroke and one arm is paralyzed, it gives function. There's some that are more mechanical, like an exoskeleton. So there's pieces that go outside the body and they stimulate. The thing with the electrical stimulation is the amount of sensation that you have. So it just depends on if you can tolerate the electrical stimulation or not. Sometimes people who have really dense paralysis and they have effects on their sensory, they can really tolerate it. Some people have diseases where they're kind of hypersensitive to pain, and it might not be the thing for them yet, but they're working on all those things to try to get this to as many people as they possibly can. The next question is, how can I share my story about how I became paralyzed? And there are so many ways. So I don't know what your purpose is. Sometimes people want to write their story because it's cathartic for them. Sometimes people want to write their story and tell their story because they want to forewarn other people. Now it's springtime school beginning out. We'll start to see a few commercials on TV about diving, and don't dive into a shallow pool. Don't dive into a body of water where you can't see the bottom, because people land on their head, they break their neck, they're underwater, they're drowning until somebody notices and comes and pulls them out of the water. So there's a lot of things that will be going on, but you can certainly post things online. You can write a blog and ask the Reeve Foundation to post it. There are other organizations and groups that post, have exchange for people to exchange their stories about their spinal cord injury. Or if it's not spinal cord injury, maybe you became paralyzed by some other way. But these are all important things. Sometimes there are medical things that happen to people that are very unfortunate, that cannot be foreseen. And so there's all different ways people become paralyzed. So sharing those stories can become very important. If you would like to, and you're feeling bold, you can contact your local TV station and they might do a program about you. And, this is how I had my spinal cord injury. This is what's happened. Your local news likes to have stories about people that are able to articulate, this is what happened to me and this is how I'm succeeding. They always like stories about people who are succeeding in particular. And then sometimes they get picked up by the broader news media. So that can be very helpful in your own community. You might want to talk about your story if you go to like a Lions Club or Optimus Club, or, different community activities. They might welcome you to tell your story and those kind of things, because it's important for people to know what it's like to live with a spinal cord injury. Spinal cord injury is really very rare. It's shocking to find that out, but it's true. Now, a lot of people have spinal cord injury from diseases, but then those people relate to the disease as opposed to the spinal cord injury, even though that's a consequence of their disease, like multiple sclerosis. People don't say, "Oh, I have a spinal cord injury." They say, "I have multiple sclerosis." So if you let people know there are all different ways and types of things that can happen, it really helps people understand what's going on, and it helps the cause for all of us. The next person would love to hear about any improvements for managing bowel, bladder, and spasm issues. And yes, we have a lot of things that are going on in, again, that electrical stimulation part, where bowel and bladder programs are being improved, spasticity is being reduced. So electrical stimulation helps a lot of that. And, that's the big buzz now. I bring it up a lot because this is the thing that's going on. And this is such a jump forward for us in treating all these different secondary conditions, we call them, of spinal cord injury, of paralysis, no matter if it's spinal cord injury or brain injury. This is the thing that is the biggest step forward in a long time. Now, there's a lot of things that are going on, and a lot of things are still being worked on. As far as the bowel goes, the bowel program is still our traditional bowel program. That hasn't really changed, but there are people that are looking at different medications, different stimulation implants. If you have a spinal cord injury that's in the lower spine, in the lumbar and sacral area, that's where you have that flaccid effect. You don't have the tone that the people who have the higher level thoracic and cervical spinal cord injury tend to have more tone spasms. And the lower level injuries are more flat and, flaccid. And are some surgeries, if you have lower level, where nerves are transferred in the cauda equina to help improve bowel and bladder and sexual function. There's implants that can be inserted that will help with bowel and bladder. So there's a lot of things that are going on, but a lot of people don't know a lot about all these things that are going on. Spasms is another kind of interesting area where we know that the electrical stimulation helps. We know that there's medications that help, but there's a lot of alternative therapies that people are having luck with. So like biofeedback and acupuncture and acupressure. Some people are feeling like they're doing real well with that. Now that is kind of a tricky situation. There's some research that demonstrates that this is helpful, but it's a small body of work. But if you go into some of these alternative therapies, you have to go in with the mind frame that this might help me. A lot of people don't do the alternative therapies because they don't believe in them. And so that's never going to work. So if you just like, yeah, this isn't working, it isn't working, it isn't working. All these things take a lot of trial and effort to find just the right dosage, so to speak, for you. So there's all kinds of things that are going on, and there's a lot that's moving forward. We've all heard about the brain stimulators, and people are most familiar with the Elon Musk because he's a good marketer and he gets a lot of information out there. And I'm hoping for him as I'm hoping for all the people that are doing brain stimulation. But there's a group that the Reeve Foundation has just recently connected with, where there are other people that are doing these brain implants to help with increasing function. There's also the exoskeletons that are becoming more and more popular. They are out in market now. They're kind of bulky devices. You have to carry a power pack on. I was just talking to a friend of mine the other day that uses the exoskeleton, and she'll go walking with her son. To get the FDA approval, you have to have a caregiver with you when you use the exoskeleton because of legal issues, if you fall on a step or whatever. But she was talking about how that has improved her life. And she says, people think it's not like you're walking as you were before, but it is a form of walking. It's more for therapeutic exercise walking, but you wear this external device. There's not electricity usually accompanied with them. I'm sure somebody's developed one who has an electrical component, but it's an outward frame that you wear, and it moves your body and you get to go where you need to go. And she says what has made such a huge difference for her is because you can do steps. And what people forget about is that a curb is a step. So even if you're out just walking down your street, getting your exercise, there are curbs to go up and down. And she says, you think about, climbing a whole flight of stairs, that's one challenge, but just to be able to go up and down a curb is a huge deal. And so she was really excited about the success that she has. There's a lot of other things that are going on that people are still working on. I am working with a group of people that is full disclaimer, I'm working with them, that is developing a device that will call you when your bladder is full. And it runs by volume, it runs by pressure, but it will call you on your cell phone and say time to empty your bladder. So if you're doing that intermittent catheterization or you have pressure problems, that's kind of another alternative. It is not out yet, but it's coming soon. Another question is, so there's lots of things. Every time I turn the corner, there's something new. So that's great. Another thing was somebody had asked about a skin cream that was discussed in previous sessions, and they questioned if it was Noop, Noop. And yes, I hear a lot from the community that people like to use this Noop skincare cream. It's available online. There's a lot of skincare creams out there. There's not a skincare cream that is going to release the risk of pressure injury, but hydration, even if you get some cream that hydrates, they have a special skincare lotion that is now for people who have diabetes. And it really hydrates the skin because when you have diabetes, your skin gets dry, and it really hydrates the skin. And sometimes I tell people to try some skincare lotion that's devised for diabetes, because after paralysis, your skin can become so painfully dry. And when it dries, it cracks, and that can create pressure injuries. So hydrating through your mouth, and taking water is the best internal hydration, but you also need to hydrate the outside of your skin because you don't see it and you can't feel it, but that very top layer of skin is actually a film of water. And when your skin's really hydrated, it feels soft because it's water on there. And it's not like your skin, unless you're sweating, it's not dripping water, but your skin has this film of water that's a protectant on it. So we need to hydrate from the outside as well. And one of the ways to do that is to use an emollient type of screen lotion to keep your skin moist. And don't forget, also summertime, don't forget your lips, and hydrate your lips with some chapstick or whatever you choose to put on your lips, and protect your skin from the sun. I got a wonderful hat. I love my daughter, and she gave me this wonderful hat. It's got this big brim, and oh, it's so cute. I'm a girl, what can I say? And it's got this little straw bow on the back, and it's just the cutest thing. It's open on the top, and I took it down and wore it when we went to see the eclipse. And I wore it down there, and it was such a lovely day. We sat in the shade, not out in the sun. It was a very cool day, and the sun went away, but the sun came back. And when I got home, I had a great big sunburn right along the part of my hair where that hat didn't have a top to it. I was, how that happened, I don't know, because I wasn't out in the sun that much, but it just shows you how quickly these things can happen. So, think about the big brim, and cover up as best you can to keep that skin nice and hydrated. Somebody wrote in here, and they're talking about Medicare and how medical care today is affected by Medicare, and that is so true. So they were looking for some neuro-focused centers, particularly they're looking in the Northeast, and there's up in New York, Philadelphia, there are a lot of places that treat neurological issues. In New York, in the city, there's Rusk. In New Jersey, there's Kessler. Those were probably the ones that I referred to in New York, but there's also some great facilities in the Pennsylvania area, in Philadelphia. So just look up neurorehabilitation near me, and you're going to come up with a whole lot of places, some that will be closer to you and some that will be a little bit further away. Oh, back to the Noop thing, is the product LMN Noop? And I believe that it is. I don't know what the LM stands for, but I just hear people talk about Noop. They just call it Noop. So I don't recommend any products, but I just hear a lot of people talking about it. But I diverged here. So there's a lot of neuro centers, especially in the Northeast, because there's such a concentration of people there, so that there's more rehabilitation centers there. But there's a lot of centers there. And also in the Northeast, there's pediatric centers. So you have the Kennedy Krieger. In Pennsylvania, you have a Shriners Hospital there. That's not Shriners hospitals are around the country. There are only a few of them, but they're all around the country. Some are specifically for children with spinal cord injury. And in Philadelphia, there is one there. There's one in Chicago, and there's one in California at the Shriners for children there as well. I think those are the three. But there's a lot of excellent rehabilitation places. In Florida, you have the Miami Center, the Miami Project, and in Chicago, you have the Shirley Ryan, and in Texas, you have Baylor, and there's several down in Texas. I mentioned Baylor, but there are other ones down there as well that are equally as good. In Washington, you have the University of Washington, and in California, you have Ranchos and several others as well. So they're all over. In the bigger cities, you tend to find more academic type medical centers where they're doing research. And so you get a lot of the latest and greatest at those places. But you can also get information in by going to your local rehabilitation center. The two big rehabilitation centers that are strictly for brain and spinal cord injury is Shepherd Center in Atlanta, and in Denver you have Craig Hospital. So these places are all over. You just have to, do your homework and look around. If you are not, if you are in a state, Medicare usually, and Medicaid in particular, will want you to go to a facility within your state. So sometimes you might live in a big state and that facility might not be as close to you as you would like. But you can also take advantage to look at the websites of these major medical centers. They have a lot of information on there. Of course, we have the Reeve Foundation that has all this information that, is at your fingertips as well. But sometimes you don't really need to go to a major center because you can take advantage of the educational material that's available on Reeve, on the Craig, the Shepherd, the Shirley Ryan. They all have websites, they all have information. So there's a lot of videotapes that you can watch. And so there's a lot of information out there no matter where you go. Even if you decide, some people don't want to go to a major center, they want to stay local because they want their family support and they need their family to be by them, or for whatever reason they have. It's certainly a choice to go to a major center where you might have to travel a bit away, or to stay local. And there's advantages to both. So it's really up to you what you decide you want to do as far as where you want to go. But you need to go where your payer's going to pay. So always check and make sure that you're getting your coverage that you need, because those bills, as we all know, are very expensive. Here's a man who has a wife who has a C3-6 incomplete tetraplegia. They're interested in whether FES for her arms and hands is worth pursuing. Well, she's incomplete, so it will depend on if how much sensation she has. She can tolerate it. Now they can put it on pretty low stimulation, and you can still have improvement. But is it worth pursuing? The only way to find out if that would be worth pursuing for your wife, because we're all unique human beings, is to talk to your healthcare professional and get a trial of it. Everybody has in their insurance, even in Medicaid, you have 2 weeks of mobility training. And so a lot of times people will think per year, 2 weeks per year of mobility training. And it doesn't have to be 2 weeks in a row. It can be on Monday for 14 weeks. And so that might be a better alternative to try out a piece of equipment and to see if it's worth pursuing for your wife, to see how she tolerates it. So mobility training doesn't have to mean getting up and walking across the room. Mobility training can be learning to transfer from your wheelchair to your bed, or it can be learning to use a device like this, which might give you better hand function, which will help with your mobility. So that term mobility training is used in a very immense way of uh, figuring out things for yourself. So never let that 2 weeks go unspent, because you can learn to use a standing frame. You can learn to use your wheelchair. You can learn to use different kinds of equipment. You've been out of your rehab for a while. You need a little bit of a tune-up. You can take that 2 weeks and learn to use it, in any way to your advantage. We were talking about spasticity, learning to do some exercises that will help control your spasticity. So that can all be done under mobility training. Your physician has to write it in such a way that whatever it is you're learning to do relates to mobility. But people can get very clever in how they do that. And so always take advantage of that. So be sure and talk to your healthcare professional to try out electrical stimulation. And, if it works, great. And if it doesn't work, then but there are all different kinds. Electrical stimulation is not always provided at this huge stimulation, like for powering a bike. There are smaller stimulations that might be just enough since she's incomplete, that might be just enough to oomph her right up into doing some things that she couldn't do without the electrical stimulation. So be sure and check it out and see what's going on there. The next person who says that they had a laminectomy and they're having pain and spasm, even if they do PT every day. So this person's considered incomplete spinal cord, and they feel like they're getting worse. So this would be an opportunity to talk to your healthcare provider about movement is a basic way to take care of spasticity, but you might need some medication. Um, in the, and it might be just a little tiny dose of medication that might help. Maybe some e-stim might help reduce some of your spasticity. So you'll need to talk to your healthcare provider to see. We have a hierarchy of treatment for spasticity, and we'll start out with movement, and that will take care of low-level spasticity. And then we move into the medications. Some people will choose to move into other things like biofeedback if they don't want to take the medications. Some people just don't like taking medications, but they can be very helpful in managing spasticity. And then it goes on to surgery, so you can get an implant where you can get a baclofen pump that will help reduce some of the spasticity. Maybe you don't want oral medications, but you can try some Botox into the area where the source of the spasticity is coming to relax that a little bit. Botox injections have to be done every 3 to 6 months. They have to be repeated because Botox wears off. And so there's all different kinds of treatments, but you might want to look into seeing uh, what's going on with that spasticity. Now, if the spasticity tends to get worse over time, but after a while, sometimes people who are on some spasticity medications, and nobody knows how long this takes, but for some people, after a while, they'll slow down on their spasticity medications. They find it's just resolved. Same thing as neuropathic pain. People will take medication for that to help control that. And after a while, people, for one reason or another, they want to try a newer medication or whatever, and they have to go off their medication because you can't be on two at one time. And so they have to go off their medication. They're like, well, wait a minute, I'm not having that pain or I'm not having that spasticity. So sometimes those tend to resolve. Now, with a laminectomy, it could very well be, you might want to go back to your surgeon and be reevaluated, because sometimes people will get spasticity or they'll get pain because of the healing of the laminectomy internally. So if you look at your skin and you get a cut on your skin, you'll see it gets red, it gets a little swollen, it's a little tiny thing. That's the way the body heals itself. It happens on our skin outside our body, but it also happens inside our body. So there could be a little cyst or something that's developed in that side of that laminectomy, or it could be that there's some inflammation inside the body that is acting up for some particular reason, because the body's trying to heal itself. It's an ongoing process. So check back with the original surgeon, make sure that that's all okay there. And then other than that, look at maybe the next higher level for dealing with your spasticity. You might want to try the Botox. You might want to try medication, or you might even be eligible for a baclofen pump. This next person has a spinal cord injury, and unfortunately, the whole question got cut off. So I only talk in generalities anyway. I don't know anybody who writes these questions, so I can't say this is the thing you need to do. But this is a person that they have gastrointestinal issues, and they wish that there was a lay list of medications that are possible So they had a spinal cord injury, and after a spinal cord injury, your bowel slows. The peristalsis, the stool moving through the bowel slows, but the part of the bowel that extracts fluid from the stool. See, so when you eat something, you get it in your stomach, it really your food goes in the small intestine as a liquid. And as it goes through the small intestine, and especially when it goes through the large intestine, fluids being extracted so that your stool becomes more of a soft, solid product. But it starts out as a fluid. We call it chyme. It's a word, the bile mixes in and things get, and that's how the nutrients get out of your food. So it comes through, but the fluid is constantly being extracted. So your bowel peristalsis, how the stool moves through the bowel, is slower, but the fluid still be taken out. So sometimes people will say, "Oh, I'm constipated," and you are, but it's because of the nerve problem. So treating constipation will not help the nerve problem. It's the slowing of that peristalsis because that fluid's being withdrawn, withdrawn, withdrawn. And so your stool gets very dry. So you have to be able to treat the peristalsis. And if you're taking some medications, and I don't know. Oh, it says a gastro told me about meds that don't allow opioids to stop the movement. So there are different medications. We don't really recommend opioids in paralysis, or opioids are not really used that much because they're so addictive. And the way they treat pain is that they make your brain less conscious of the pain. So they kind of make you sleepy, a little brain fog going on, but they don't treat the site of the pain. And there are all different kinds of pain. So, if you pull a muscle in your back, it hurts. If you think about neuropathic pain, that's nerve pain. Ooh, it's a wicked little pain. Um, it's just a little devil there. If you think about if you've ever had a toothache and how that toothache is just so painful, that's nerve pain. So if you have a family member or if you're a person and you're feeling this really wicked kind of pain, that's neuropathic pain and it needs to be treated. Now, opioids slow down the bowel, but there's a lot of medications that also slow down the bowel. So if you're having pain that you're taking opioids, you might want to ask, and if it's nerve pain, you might want to ask if you can switch to a very low dose antidepressant or very low dose anti-seizure medication. Now, this will not treat depression, it will not treat seizures, but the side effect of those is control of nerve pain. Interestingly enough, people who have paralysis that have seizures and take seizure medications or have depression and take depression medications, the full dose, very rarely have neuropathic pain because side effect is control of that. So if you're not taking those medications, you can try those at a very low dose, and those often help neuropathic pain. Or you can take two medications are specifically created for neuropathic pain, and that's gabapentin and pregabalin. Those are big words. So gabapentin or pregabalin. And we have a booklet about the hierarchy of treating pain, and which can help with also with bowel control. I think we had the bowel management booklet up there, but that will give you a lot of tips about your diet and how to help control for that slowing of the bowel. So sometimes people think, well, if I treat for constipation, that will make my bowel program go away. Well, it will not. You can have a neurogenic uh, bowel from paralysis, which is a neurogenic bowel, and have constipation, but you have to treat the neurogenic bowel part to make the constipation better. Okay, so it kind of works in that way. So there's all different things you can try to help with your bowel and get your bowel functioning better. Things that you eat. managing your bowel program, adding fiber to your diet. We used to say to everybody, take a fiber supplement, because with paralysis, especially with spinal cord injury, you cannot ingest the amount of water you need to take with those supplements. So we don't recommend those anymore. Now, if you're taking a fiber laxative like Metamucil, and you take that for your bowel program and it's working well, don't stop it. Keep up with it. You don't want to just stop any medication without checking with your doctor. So those are just kind of things to know, but you can get enough fiber from your diet. You just have to be conscientious about what you're eating. So my 58-year-old son has a partial spinal cord injury at C2 in May 2023. No other injury. He has partial use of his limbs, is mentally intact, able to speak. He's had pneumonia 4 times and is raising his carbon dioxide levels to crucial levels. So we know that the C2 is right up at the top of the brain stem. That's right up there where the skull and the the spinal cord is coming out. That's also very close to where you breathe. So breathing can be a challenge. It can be kind of slow. It doesn't say that he's on a ventilator. But at C2, you might be. So it usually complete injuries at C2 have ventilators. It says partial use of limbs. So I'm thinking that this is an incomplete injury. So he might be off the ventilator. If he's on the ventilator, you want to be sure and use the side button as recommended. So you press a button and it gives a deeper breath. Do that intermittently. Sometimes it's built into the programming that every so many breaths, you'll get a sigh. So you want that deeper breathing. If you're not on the ventilating, you want to breathe in several times a day. Breathe in very deeply, as far down into the lungs as you can possibly get, and exhale, and then maybe rest. You might not be able to do it 3 times in a row because it takes a lot of energy to do this. Do it again, do it 3 times, and then try to produce a cough. And try to have the cough come up from as low as you can. You might not be able to breathe deep into the lungs to be able to do that. You can also please check with your doctor first. Coughing and deep breathing is pretty benign, but check with your doctor first. But there's also very cheap exercise that people do where they'll take a straw like from one of those thick drinks, a frappe or something like that, one of those real thick straws. And you can cut it a little shorter. You don't want to cut it too short because you're going to breathe in through it. And you don't want to breathe in through it and it's so short that goes down your throat. But you can start out with cutting the straw in half because there's less resistance. So take a really wide diameter straw, and breathe in through that a few times. Take some rest. We're not here at the breathing Olympics. We don't have to do it this afternoon, but several times a day, breathe through that straw, and that gives some resistance to breathing in. So it exercises the lungs a little bit. As you get comfortable and that you're using the larger straw, change to a normal diameter straw. Now, I notice at the fast food place, the straw diameters are a little bit bigger than what you buy in the store. So get one of those, do the same process until you get used to that. And then you can go down into store-bought straw, which have a smaller diameter. And then some people, not everybody get here, and it doesn't matter if you get here or not, but some people will use a coffee stir. You know how tiny they are? And they will use that to breathe in and breathe out. You don't want to start with that because it's too much of a challenge. You want to start with a really big straw and then work. I have noticed online that there are straws that you can buy in a kit that go through these sequences. You don't really need to do that. You can go to different places and pick up a couple of straws for free. And if you talk to usually they're sitting right out on the counter, but if you talk to the person and say, I need about 5 of these really large straws, and would you mind just giving me a couple? And they probably will. Some places won't. Okay, move on to the next place. But you can buy them online for your particular size that you're using, or you can buy these sequential ones. I think that's kind of a bit of overkill, but it's nice that somebody has the ingenuity to do it. If you have some extra money around, you might want to go ahead and use that. Be sure and wash the straw after you use it, because you're blowing through it. Your moist breath is going to be going there. You don't want to infect your lungs because you're using a dirty straw. But you can rinse them out in the sink, when you're doing the dishes with soap and water, and let them dry. Or you can, if you have the plastic straws like I have in my water bottle that I carry, they have some big straws in those as well. And I put those in the dishwasher and they will come out fine. So that would be that would be an opportunity, because you want to reduce the risk. If you're going out, now, I know there's a lot of controversy, but if you're going out and he has hand function, you might want to wear a mask, especially if you're in a large crowd, because there's still people. I heard of an outbreak of COVID just today, just this morning before we came on. I thought, oh no. So you want to know where those outbreaks are in your community. So, you can call your health department. I'm going, north town here or someplace, and is there a COVID outbreak? Or if you're going to a regular place, if your son goes to school and there's an outbreak on campus, you might not want to be around that when it's going on. If the flu is going around, or RSV, or any of these viral infections that affect the lungs, you want to be sure and, use your protective mechanisms, wear a mask. If you don't have hand function, you should not wear a mask, because you can build up your carbon dioxide within the mask. And people will tend to fall asleep, and you think, oh, they've fallen asleep, but they're not getting the air they need. So people can, die with that. So you want to be able to take the mask off if you feel like you're not being able to get your air. And then, wash your hands. Be sure people around you are washing your hands. If somebody has a cold, you don't want to visit them that day. Take all the normal precautions, but then also check with your physician about these lung exercises. Now, the straws you can get for free. There are also devices you can use. One is called Power Lung. There are some other brands as well that you can use that restrict the amount of air that you can take in, and then also the air that you push out, which is equally as important. But be sure and you check with your physician to make sure, because if somebody is having breathing problems, you don't want them breathing through a straw and further reducing their air that they're getting in. So, we want these to be helpful, not hurtful. There's a person who's having bladder issues with urine output increases in the morning and more leaking. So I'm thinking that's leaking through the urethra and not around a catheter. Usually people don't have more leakage in the morning because they've been asleep at night and they haven't been taking in fluid at night. So usually the bladder is less full. It's usually in the evening when people have more bladder leaking, because when they put their feet up at night and the dependent edema comes up out of their legs, even if you don't see it, people sometimes collect edema in their legs when they're not moving their legs. And so people tend to have more urinary problems in the evening time with higher volumes, which can be corrected by laying down or putting your feet up for like a half an hour, and then catheterizing as your last night catheterization. But in the morning, that's kind of odd. So I'm thinking it's a positional kind of thing, where you're standing up and or sitting up and your bladder is changing position. And so more urine is tending to come out. You might want to check with your doctor to see if you need a little medication to tighten up that sphincter. If that, if you're not wearing a catheter, if you're leaking around the catheter, you might want to check with your physician about a different size catheter that might be more helpful. If you're doing intermittent catheterization, maybe you need a larger size if you're leaking around that catheter. So that is probably a positional kind of thing. If you're not catheterizing in the night as maybe you need to, then you would have a higher output in the morning. So, check all your different systems. Oh, I used to cath at night and now I stopped and I didn't want to get up at night, so I just sleep through it. So sometimes people will cath like at 11 o'clock and then wait until their 6 a.m. catheter if they or the 5 a.m. cath if they can do 6 hours in between. You don't want to go longer than 6 hours in between without catheterizing. And that could be why there's so much more urine in the bladder if you haven't catheterized in the night. Here's a very good question that is a philosophical question. And it says, why immediately after an accident, are you told by the doctor you will never walk again? Yet you're asked to try to move your toe. It's so discouraging. Yeah, I get that. And I'll tell you, this is a philosophy in medicine that we are trying to combat now. So, if you have a complete injury, it used to be we would tell people that they would not walk again because we were preparing them to get ready for what their life was going to be like. But now we have so much more hope. And you know who gave us that hope, who really got the hope thing going, was Christopher Reeve. And his recovery project proved that there is, well, he proved that there is life after spinal cord injury in a big way. He proved that. But also, he proved that you can regain function after spinal cord injury. And it takes a lot of work to do that. And so if people are saying, well, you're never going to walk again, that's kind of our old way of thinking, but it's still out there. Not everybody has seen the light and drunk the Kool-Aid as I have, but I've seen people get return of function. So, it's still in the early stages. It's not everyone gets the reward that they've worked so desperately hard to get, but it's happening and it's going to continue to happen more and more and more. So why do they ask you? That is part of the test to see if there's any nerve fibers connecting through to the very end of the spinal cord. That's why they do the rectal exam, because that's the last nerve out of there. But they'll ask, can you move your toe? It is a very odd thing, but it happens. It happened to Christopher Reeve. We're not in his toe, but he got this weird little finger movement. He called it his party trick because it didn't do anything. But we capitalized on that and got him a device that he could use in his wheelchair because his moneymaker was his face. He's an actor that made his money. And so he didn't like to use the sip and puff because it interfered with his looking and the way he looked and his acting. Some people, we all have different things in life, and that was a bother to him. And so we got him a little dial where he could just take his finger and just with that little tiny movement, he could power his wheelchair. It took a lot of practice and he could do it, but he was always afraid that maybe he'd have a spasm in his finger and he'd roll off the stage or something. So he didn't do it publicly, but he did do it sometimes privately where he could direct his wheelchair without using his sip and puff. So some people get these weird little movements, like a toe will be able to move, and then maybe a couple more toes. So it's a really good sign. So uh, a doctor might ask you to see if you can wiggle your toe. Now, it's a good exercise to be able to think about if you can position yourself to look at your toe. Maybe you're in bed and your foot's propped up, your legs propped up. Look at your toe and think about it moving, because we do a lot of therapy that in the body that makes the connection rise up to the brain. But while you're having your therapy and somebody's moving your leg, think about, I'm moving my leg. I'm moving my right leg. My knees going back, my knees going up, my toes are going down, my toes are going up. That sends the messages from the brain down to usually the place where the spinal cord injury is. But if somebody's sending that signal up and you're making that signal go down, you have a lot more chance of making a connection there. So it's always important, somebody's doing your range of motion. It's easier to put the headphones on and I'm just going to zone out while they're moving my body. No, be an active participant in it, because that's very, very helpful. Here we have a peer mentor on today. Hello, Judy. If you're interested in some more things at the Reeve Foundation, think about becoming a peer mentor, get involved in the advocacy program. Just a few more questions that we have going on. The lift feature was passed by Congress. So when does it take effect? Well, after a bill is passed, it has to be enacted. And so all that is in the process. And maybe it's been enacted by now and I just don't know it, but it's a whole process when all this stuff, keeps going and going. So it's in the works. And then it takes a while for companies and insurance companies to get adapted to that. A person has pressure injuries and they've just been verified as a diabetic, so they're taking medication for that. And so they need to know about pressure injuries and the way to heal a pressure injury. I think we had the pressure book go by, if pressure injury book, and I'm sure it will come up shortly. But the way to heal those is to stay off of them. So people think they have a pressure dispersing equipment. I can sit on my pressure injury. There is no pressure dispersing equipment. They reduce your risk. They don't reduce your injury. So if you have an injury and you're putting pressure on that, and I suspect after 3 years you've been sitting on that or laying on that wound, and those are that's going to keep the wound there. So the only way is to stay off of it. And I know that is such a bummer, but that is the only way. Now, some people will have, after a while, they'll have surgery and they'll have the wound closed. After you have surgery on the wound, it's going to be 9 months to a year of being in bed off that. So you might as well spend some time in bed off of it now. It'll be a while, get it healed up, and then you have to start re-titrating your sitting. So you can't have, oh, it's closed. Wow, I'm going to sit up all day tomorrow because it's all closed, because it's just going to bust wide open again. So you sit up for 5 minutes, get back in bed, check it. If the pigment's changed, you've got to sit up less. If it hasn't changed, then you can move up. After doing 5 minutes for a week, then you can move up to 10 minutes and do it a couple of times a day. So it's a process, even after the wound is closed, to rebuild your sitting tolerance, and always use your pressure dispersing equipment because that is important. It helps reduce your risk. It helps reduce the pressure, but it can't eliminate that pressure injury, and it can't eliminate your risk from getting one, but it can greatly reduce it. Never use hard surfaces. Pillows collapse, they don't work. Craft foam will not work, they collapse. So you have to use the medical grade equipment. One more thing I'd like to say as we're at the top of the hour, and that is the Abilities Expo is coming up on June 22nd, which is, well, it's the Friday, Saturday, Sunday, but June 22nd is Saturday, and I'll be there. So if you're in Chicago, come to the Abilities Expo because I would love to meet you. I've been meeting people at these expos and it is just fabulous because we always have great conversations. I like to know what you're up to, what you're doing. Their booth, the Reeve booth is there, all the information. Well, there's so much information, all of it can't be there, but there's a lot of information there that's very helpful. I'm there on Saturdays. I do a presentation at 1 o'clock. And so I would be delighted if you would come. Please identify yourself. I want to meet you. I want to see you. I want to talk to you. So be sure and attend that. And I look forward to seeing you there, and I'll look forward to seeing you next month. So thanks so much for joining us today.